Hey, I'm Kayla Matthews, a local birth worker in Memphis, Tennessee, and I'm excited to talk to you about the importance of hygiene in pregnancy. So, taking care of your health is important, more important than ever when you're pregnant, because you want to make sure that you are maintaining the proper hygiene to ensure that your pregnancy is healthy for you and your baby. In this video, we're going to discuss the importance of hygiene during pregnancy and how you can stay clean and healthy as the trimesters progress. There are a ton of normal hormonal changes, increases, and decreases that pregnant people experience that increase the amount of sweat that is produced, that could increase the amount of vaginal discharge and the consistency of said vaginal discharge compared to non pregnant people. Pregnant people are actually more vulnerable to infections and germs in the environment. And so it's important that you're eating a balanced diet and wearing the proper clothing to combat these natural occurrences. And so, why should you be concerned as a pregnant person? Well, when you are exposed to certain bacteria or certain viruses or other infections, this could drastically impact your reproductive health, including your fertility. Some infections and bacteria are associated with poor fetal outcomes like low birth weight, retardation, placental abnormalities, etc. There are certain infections that one could acquire, certain bacteria that one could acquire that could actually pass to the fetus in pregnancy, and it could cause miscarriage, stillbirth, or other birth abnormalities or defects, especially infections or diseases like the flu, COVID-19, and pneumonia, to name some serious illnesses. And so, getting into some topics of hygiene and pregnancy, let's first start with personal hygiene. Bathing and showering. You want to make sure that you bathe and or shower regularly. That would look like daily for pregnant persons, again, due to that uptick in sweat and discharge. You want to use a mild, non-scented soap and water. You want to make sure that the water temperatures are safe. Avoid extremely hot water. This could cause fainting or dizziness. And you want to wash your hands frequently as you're coming and going in and out of places, before you eat, before you touch your face, before you put your hands in certain areas of your body. Use hand sanitizer when warm soap and water is not present. And then you want to make sure that you are keeping an eye out for any sexually transmitted infections or diseases, symptoms like burning, itching, stinging when you're peeing, or foul odors, or abnormal changes in your discharge. The next category I want to touch on is oral hygiene. According to ACOG, approximately 40% of pregnant people have some form of oral disease or concern in pregnancy. This can easily be prevented with some simple tips like brushing our teeth daily, at least twice daily, so in the morning and at night before bed, and flossing to prevent gum disease. There's just a fact that you have this increase of hormones, and this could cause some movement of your teeth, and it could make your gums more susceptible to certain infections or diseases. Please note that infections or diseases, oral infections or diseases, could trigger preterm labor. And so you want to avoid abscesses and other oral issues like TMJ by getting regular oral care and consulting with the dentist during pregnancy. As far as your skin care and skin hygiene, you want to make sure that you are using a sunscreen and other SPF protectants when you are in high places with high sun exposure. You want to make sure that you are staying moisturized to encourage your skin to feel good and to not crack and avoid that skin damage. There is an increase of skin issues in pregnant persons, especially melanated pregnant persons, where you may see stretch marks and things like that popping up. And so you want to make sure that you are using the proper creams and moisturizers to minimize the impact of those skin variations. And then lastly, as it relates to your household hygiene, you want to make sure that you are reading the labels of the various cleaning and disinfecting products that you are using in your household. And for your routine care, you want to make sure that these products are safe in pregnancy, that they are low in toxins, and you want to avoid exposure to harmful chemicals like bleach and ammonia. And you want to make sure that you are washing your clothes in gentle, non-toxic detergents. And if you have pets, be aware of the toxins that could be in things like cat litter. These are just some quick tips that you can consult with your provider with before, during, and after pregnancy. If you have any questions or concerns, if you're experiencing any symptoms, if you need support working through what proper hygiene in pregnancy looks like for you, be sure to reach out to your care provider to create a plan specific for your lifestyle and your needs.